Hello, my name's Julian Fisher. I'm the Director of Oral and Planetary Health Policies here at Penn Dental. For the last 3 or 4 years, I've been working on a WHO publication, a starter guide to integrating the social determinants of health into health workforce education. There is a dedicated chapter on oral health in that starter guide. And one of the exciting things I saw about Penn is the focus on disabilities, because to me that's very, very close to the social determinants and an ideal way to start implementing a lot of the theory and putting it into practice. I'm doing a lot of work on global oral health, so looking at a research approach that was both integrated and also looked at the global oral health, again here in Penn with the Center for Integrated Oral Health and the research work that they're doing. And I think more outside Penn Dental and looking at the whole university campus, particularly the opportunity to engage in September in the Climate Change Week, and again having the opportunity to take some of the work I've been doing around oral health and planetary health with this starter guide, and then using that as an entry point to engage the wider community in Penn and the departments working outside those perhaps more conventional silos with other sectors like water, with agriculture, with urban planning. So for me, a fantastic opportunity to almost do all the work that I've been doing in theory to put it into practice in such a fantastic environment. When you perhaps hear that, first of all, you think oral planetary health, that's a big leap. But the work that I've been doing, and also with members of the team here at Penn Dental, taking the new definitions of oral health from the World Health Organization and the FDI World Dental Federation, and they really cement this idea that oral health and human health are indivisible. And then if we think about planetary health, well, the planet's health is directly related to our health, and our health is directly related to the planet's health. There is a robust connection between oral health, human health, and planetary health. Most of the dialogue, the policy dialogue, and particularly around education, has perhaps been looking at oral health care and its impact on the environment, so trying to make that more sustainable. But there's another piece to that conversation, and that is planetary health, Earth systems, if you like, and climate change and the impacts of climate change on people's oral health and also on oral health services. So there's a feedback loop there. Sustainability is not flexible, is not fuzzy. There are limits within the planet beyond which we cannot really go without really causing very serious, significant problems globally. And to a certain extent, we're already seeing those planetary health boundaries being approached. So we've got an opportunity through this policy work and through the education work to make a significant contribution to making sure that we don't reach those boundaries, so that the oral health of our children, our children's children, is protected and promoted as well. As I said, in September there will be a Penn week on climate change, and we're now looking at a transdisciplinary approach. So looking at teachers in the education sector, as I say, looking at climate justice. And so that's where the policy elements come in. We need to start thinking about how does oral health relate to these bigger issues. So what's our link to these concepts of climate change, One Health and planetary health, and how are we going to engage in these sectors? I'm hoping to pass on those skill sets to students to help them engage in sectors that they probably didn't imagine when they first came to dental school that they would have to and need to engage in. The WHO resolution, one of the first or second paragraph in that resolution is that oral health is grounded in the United Nations Agenda for Sustainable Development and the 17 Sustainable Development Goals. That is a really big element of Penn's thinking in saying, well, we need to position ourselves within sustainable development, within these 17 goals. This will help us both think about engaging with these other sectors, but also gives us a more practical way of engaging, because you can look at the targets within those goals and you can look at indicators, and then you can start thinking about, well, how does oral health relate to this target, and how do some of the oral health indicators and some of the research that we've got relate to those indicators, and also that idea can be transferred to education and curricula around sustainability and planetary health and One Health. I think Alumni play an absolutely critical role. Alumni can come into Penn Dental and start learning and having access to some of the new thinking to keep themselves up to speed, as if you like. But also, I think there's a tremendous opportunity for those alumni to become educators of our dental students. So I think that's very important, that two-way conversation and understanding between the dental school as a hub for knowledge and knowledge sharing and exchange and research, but also understanding the value of those alumni to come back in and saying, but this is what it's like out in practice. And obviously the alumni contributing to education, to research and to the institution, both in terms of making it more sustainable, but also supporting some of the policy work, some of the education and some of the research that will need to go hand in hand with this set of challenges that we've got, and also allowing the alumni to engage with other sectors that probably they didn't have the opportunity to do when they were in dental school. So I think there's an awful lot of new territory to explore and exciting relationships and partnerships to engage in.